Today we're going to talk about loading in and out of the hip and some strategies that you can begin to utilize to teach your body that loading into the hip is the desired motor pattern in a lot of athletic movements rather than a collapsed front leg, quad loading, extension, and side bending away. We got to teach the hip that it can actually load, accept load, tolerate load, and then explode out of it. Welcome back to Overhead Athletics. Max Wardell. We're going to talk about loading to explode and loading in and out of the hip. It's an athletic quality or motor control quality that we need with athletes where they can actually load into the hip and load out of the hip or decelerate into internal rotation. We see it in our throwing athletes, right? So load into the hip, hip internal rotation and flexion away from the target. Boom, here. Then they have to load out of the hip, extension, external rotation, pelvis rotates towards the target. Then at the end of the throw, internal rotation and flexion decelerated by that lead leg hip. We also see it in cutting. So if you're here, you have to stop, make a cut back that way. So I'm coming forward, boom, stop, internal rotation, flexion, external rotation, extension, out of it. So we have to teach the hip to be able to load into internal rotation and flexion and load out of it into abduction, extension, external rotation. What we see with our throwing athletes, and I've seen a ton of young throwers, even high school and college throwers recently, who don't have the capacity or the motor control to load into this hip, to hold that, and then rotate out of it. We know you got to sit into that hip. That's what you hear, sit into the hip. Boom, you got to sit into the hip as you load towards the target. Well, if you don't have the rotation range of motion, it's not going to happen. But most of these athletes do have the rotation range of motion, so what's going on? What's going on is they don't have the motor control or potentially even the strength in their posterior glute med, their glute max, even sometimes their glute min to be able to rotate away from the target and push laterally towards the target. So what we do is we teach the athletes to move in a better way, and then we teach them to fortify that pattern over time. And so what you'll see here is we got a bilateral exercise or a bilateral stance with a unilateral exercise where the athlete is now in a nice athletic position. Flexed at the hip, flexed at the hip, flexed at the knee, and from there they're gonna let the band beat them, and when the band beats them, it pulls them into internal rotation and flexion on this back hip. And so what happens is they then have to eccentrically control that and rotate out. Boom, and then out. So I load into the hip, load out. The band beats me, and then I beat the band. What you'll see happen is athletes that don't like that position will begin to laterally deviate this way into almost a side lunge. They're loading the quad more so than they're loading those posterior rotational fibers of the glute. So I have to let that band beat me. I can add more resistance, or I can add more tension to the system and add more tension to that band by pulling into a row with that front arm. As I pull, it adds more resistance on the band as I get higher into the exercise. And what you'll see, and what you'll begin to notice very quickly, is that position is the exact same position as I'm at as I actually throw the ball. So athletes that don't have the ability to rotate into that hip and they want to shift, hip shift is what we often call it, or you see athletes that immediately open towards the target, which you find all the time in your younger athletes and your injured athletes. We begin to teach them that now this is a desired position that they can then maintain, and we superimpose strength on top of it. So from there, what you can do is you can approximate that very same movement, and I'll show you with my other side here, to the deceleration portion of the throw. So now I'm here, I'm in this position, I can do this, same exercise, right? Or I can come back and I can do it in a lunge stance here, or a straight leg stance. And now the exercise controls the deceleration aspect of the throw. And I've incorporated more hamstring, and I can once again do a mini row to make the exercise much more difficult. As I extend further out more extension. I get a wider base here. It becomes more and more difficult to control that with an eccentric hamstring movement at the same time as my lateral rotators and my posterior musculature has to control rotation. So very quickly, I can begin to take one exercise and teach the athlete foundational principles and movements of the hip that's going to benefit them in all athletic endeavors that they pursue that incorporate any sort of multi-directional speed or lateral power. This is what I see all the time. You see athletes that land into the valgus position in a jump. You see athletes that can't rotate away to throw the ball. If you watch them do a lateral bound, often they do this and they valgus collapse instead of actually rotating through the hip. So we got to make sure that athletes have that capacity and that ability to rotate away from wherever they're jumping or wherever they're throwing, and they can actually load into that hip to allow them to load out of that hip and explode. This is one exercise that we use all the time. Give it a try. Load up the band as they progress, and then what you'll need to do is take this capacity of the hip and actually train it into the throwing motion or into their athletic events. And so what we're going to do in our next video is we're going to actually put together a video where we go through different throwing procedures and teach athletes how to actually utilize this capacity of the hip, this foundational capacity, and then explode out of it to throw harder. Because we see these athletes all the time, boom, collapse, rotate their pelvis towards the target. We got to get athletes away from that. They don't expose the ulnar collateral ligament or the anterior shoulder to stress earlier in the throwing motion, and it actually allows them to throw harder, or in the case of cutting, to cut quicker, to jump farther laterally. So there's a lot of benefits from one little hip foundational movement that's going to allow them to have better stability and mobility over the course of their athletic career and over the course of their throwing career as a throwing athlete. It's not just something that benefits the throw, but it's something that benefits all athletic events that that particular athlete is going to pursue. So you got to have this foundational movement of the hip, which requires internal rotation, flexion, which is your loading in movement, and then boom, your loading out movement. And so check out our future video. You're going to have to subscribe to the channel so you don't miss it. Our future video where we actually take athletes in the throwing setting and teach them how to load into the hip and then how to explosively come out of that loaded position in the hip through various different movement strategies and motor learning strategies. So you guys are going to want to subscribe to the channel to check that out. Make sure to like this video if you like the content, and we'll see you guys in the next video.